got diagnosed, I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time, ang PCOS, hindi pa siya basically well-explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. Aside from the hypoglyce ko, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So, parang binabasag talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jocelyn and Sir Jhen. So, they introduced PPAR to me kasi one time we were having lunch. So, very big yung appetite ko. Akong excuse si Ma'am, always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduced na yung size. So, working on it para ma-clear na siya. Sir, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-refer ko na rin sila. Tapos, kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh, kung ano yung nangyaring changes. Good morning, I am Monique B. Marzad, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. And then when I started using PPAR, the migraine episodes, hypoglycemia, and my drastic gaining of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I trust Simply Nature.
Before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already, PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're just, waiting on the Lord and praying for His timing. And during the time when I got pregnant, I also realized that, actually we've been taking PPARs. So, because I've read and heard that PPARs helps with cell repairs, it strengthens your body, it's high in antioxidants and all that. I really think that contributed for us to have a healthy pregnancy. And yeah, that's what I also took during that time. After I have given birth, I really had difficulty because I had emergency CS. So, but on the third day onwards, I was actually feeling better. After giving birth, we're gifted with PPARs, so praise God, and that has helped me a lot because they said that the hormonal changes do not just happen during pregnancy and even after pregnancy. So we started taking PPARs also. And I know mommies who have given birth, I know you can relate to this. If you have experienced constipation before birth, when you have given birth, it becomes like more. It gets to the next level of constipation. So I'm glad I was able to take, and I was introduced to Cleansing Plus of Simply Nature even before pregnancy. So when I experienced all this constipation, when I took Cleansing Plus, it has helped me with my regular bowel movements and to be able to release easier and faster. When I felt constipated, because it's true, even after you have given birth, if you're already constipated, it's like it's gonna go to the next level of constipation. I don't know how it happened, but when I read about it, it's all because of the hormonal changes that happens in our body and our body adjusting and healing. So it's going through a lot. It has helped me because especially if you have given birth, whether that's normal delivery or you had cesarean, you're not really allowed to put pressure when you're about to go. So you're not allowed to push. So the Cleansing Plus really helps, for you to be able to release, better and easier. What has helped me in this pregnancy journey and even before that and even after is that I was taking PPARs. My husband and I were taking PPARs tablets. So that has helped me with, of course, the hormonal imbalances. It has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no contraindication, so that could also help you. So you may try on your own and test it for yourself. Hi, I'm Nesta Vicencio, and here's my son, Ethan Kairos. So I had an amazing pregnancy journey and recovery with the help of Simply Nature PPARs. Thank you, Simply Nature. We love you.
Good morning, I'm Mrs. Melinda C. Hispano. Ako po ay na-diagnose ng stage 2B breast cancer, and I'm from Muntinlupa City. I'm a public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, falls apart, sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, browsing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung Simply Nature PPARs. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder saka tablet. So at first, I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Kasi po, even my co-teachers, even my family, ang sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor, no? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most successful chemo patient in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive, binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. It's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So I'm very, very thankful to Simply Nature because it really helps me a lot. And ang feeling ko, I'm a very successful chemo patient because of Simply Nature. I trust Simply Nature.
Good evening, everyone. I'm Sheila, and welcome to another episode of Simply Healed Webinar. This program is proudly brought to you through the continued collaboration of Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. As an international leader in wellness, Simply Nature specializes in high-quality supplements sourced from a unique strain of microalgae known as PPARs. This research-backed nutritional approach is widely recognized for its ability to support cancer patients, boost immune function, and improve metabolic health. It is particularly effective for those looking to naturally manage blood sugar, blood pressure, and cholesterol level. When we talk about breast cancer recovery, the conversation usually centers on big guns like surgery, chemotherapy, and radiation. And while those are the literal lifesavers, they are only part of the story. Recovery isn't just the absence of disease, it's the rebuilding of a life. Today, we're looking past the prescriptions to the hidden factors, the environmental, emotional, and lifestyle elements that can significantly influence how a person heals. If you or your loved one are in this thick or in the thick of this isn't just about staying positive. It's about the science of supportive care. First, the gut immune connection, the microbiome, where we're finding more evidence that the health of your gut bacteria plays a massive role in how your body processes treatment and manages inflammation. The factor, high fiber diets and fermented foods aren't just health trends here. They help regulate estrogen levels and support the immune system as it recovers from attacks of chemo. Let's make sure that it's only on moderation. The goal, nurturing your internal ecosystem to reduce treatment-related fatigue. Second, the sleep architecture. We often tell patients to get some rest, but circadian rhythm disruption is a hidden hurdle. The factor is cancer treatments can wreak havoc on sleep cycles. However, deep sleep is when cellular repairs happen. The strategy research suggests that maintaining a strict light dark cycle, getting natural sunlight in the morning and total darkness at night can actually help the body's natural suppression of tumor growth by keeping melatonin levels stable. And third, the power of the social scaffolding. This is perhaps the most overlooked factor, the social isolation versus integration. The factor, it's not just about having someone to drive you to appointments, it's about emotional buffering. Studies have shown that patients with strong social networks often have lower levels of cortisol or the stress hormone. The impact is that chronic stress can lead to chronic inflammation, which is the enemy of recovery. Whether it's a formal support group or tight-knit circle of friends, that scaffolding keeps the nervous system in the rest and digest state rather than the fight or flight. Recovery is a marathon, not a sprint, and the finish line looks different, of course, for everyone. While the medical team handles your pathology, you and your environment that you build handle the restoration. By focusing on your gut health, honoring your sleep, and leaning on your community, you aren't just surviving, you're reclaiming your agency. Remember, medical treatment adds years to your life, but these hidden factors add life to your years. Everyone, the intention of today's webinar is to make sure they answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA is our highly expected health experts. It's a pleasure to introduce Dr. Jansen, an alumnus of St. Luke's College of Medicine. Dr. Kalalan is a distinguished diplomate of both the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. He currently serves as a consultant specializing in integrative oncology across several premier institutions, including Alta Integrative Medicine and Wellness Complex, a Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. He will be joined by a Singapore-based PPARs expert. As the visionary CEO behind Simply Nature International, he combines both the entrepreneurial success with years of international speaking experience to share deep insights on how health serves as a foundation for true success. Let's all welcome Mr. Shyan Lim. Hello, Sir Shyan, and good evening, Dr. Jansen.
Good evening, Doc. Good evening, Sheila.
Hi, good evening. Hello.
Let's go.
It's nice to have you both today, sir. And of course, I just want you to know this is actually the week where we are going to, this coming weekend, we are celebrating, of course, the Mother's Day also. So there you go. All right, for our first question, Coming from Miss Miriam. My mom is 70. She has a goiter, but lab results were normal. So they recently detected thyroid lumps as per biopsy. It is multiple lumps. Some are cancerous and non-cancerous. Suggested for surgery, and she is worried that she is worried. That's why they are looking for alternative. What is your best recommendation for her?
This sounds like a viewer last week, right?
I think she wants reassurance for this.
Okay. Okay.
Okay, I'll talk about guidelines and what happens if you delve away from the guidelines. Okay, so for this kind of cases, if you follow the guidelines, that is really surgery. Why do they recommend surgery? It's because surgery is the only treatment that will give you the most increase in survival. Why is this so? Why is this so? It's because surgery takes out the headquarters of the tumor in your body. Okay? But of course, we're talking about the thyroid. The trade-off there is you have to put the patient on lifetime thyroid hormone therapy or thyroid hormone replacement therapy. Okay, which is just basically taking a few pills every single day. Okay? Very, very simple. Now, once so depending on the stage, we can further recommend radioactive iodine. So the radioactive iodine here is going to kill the cells that's circulating in your body, or in which those that might have metastasized. Okay? Think of radioactive iodine sort of like a chemotherapy in a way, okay, which will eradicate the remaining cancer cells. So the role of radioactive iodine here is to prevent relapse, okay, or it's to prevent recurrence, okay. So that's going through the usual path. Now, radioactive iodine is it's not toxic to the body. It is toxic to the cancer cells, but you eliminate the radioactive iodine through your kidneys. No, in 2 to 3 days, that's gone. Okay, and then you focus on repairing the body because you have been exposed to radiation in a way. Okay, so so that's the conventional side. So if you delve away from this, what's going to happen is you go into my world. Okay, now what happens here is that um how I look at cancer, the lens in which I look at cancer is not really very, very specific, like the conventional oncology, because for conventional oncology their treatments are very precise, so there are specific drugs for specific cases. Okay, now for my side of things, what I need to know is just if it is cancer or not. So since you're diagnosed with cancer, the treatments now would be metabolic, immune, and cytotoxic. So this is how I approach cancer. So for metabolic, the principle here is to starve the cancer of fuel. Okay, so the fuel of cancer would be cholesterol, sugar, or glucose, and glutamine. So we starve that. We stimulate your immune system, so the immune system kills the cancer. Okay, and we give cytotoxic treatments to kill the cancer cells themselves. We don't attempt to shrink the tumor. Okay, we just make sure we just make sure that the patient remains stable. That's the goal. If we do get tumor reduction, that's a big, big, big bonus. And sometimes you do get such cases wherein we see that the tumor shrink. Now, the best, the what I would recommend is to marry the two, is to combine the two, because there are certain limitations in conventional cancer treatment, and there are also limitations in integrative cancer treatment. Okay? One limitation would be the speed in which we reduce the tumor burden. Conventional treatment, just one day, you can remove the entire tumor. Okay? But for us, for in the integrative cancer care, the time frame here is months to years. So you have to be on the protocol for a very long time. Okay? Now, another limitation or one benefit would be, of course, side effects, which is what's pushing you towards our side of things. So, of course, for conventional treatment, there are a lot of side effects that we have known of, which really turns off patients. On our side, there are side effects. Okay, there are side effects, but they are milder. And in general, they are more acceptable for patients. Yeah. That's my take on it. My advice is to mix both. Okay.
Thank you, Doc. Sir Shyan, would you like to add anything?
My advice is have a consult with Dr. Jansen.
Yeah.
Obviously, this particular viewer you asked last week, and again you're asking this week. So instead of getting a answer from us through this program like this, which is not correct, all right? Because whatever we do is only for education to help you decide what's your next step. It's not an advice, it's to give you information for you to take your own next step, right? So obviously, you like what Dr. Jansen is saying. He is offering you a combination and what exactly to do because you're looking for alternative, right? You're looking for alternative. So there is a complete package that takes into consideration. So one thing that Dr. Jansen will not do right now is to tell you yes or no whether you can avoid the surgery because he doesn't have enough information. So the right way to do it is to go for the surgery because Dr. Jansen and I we trust what your surgeon says, that your surgeon has already looked at you and thinks that your mother is strong enough to go for surgery and is the best option. So that's why me and Dr. Jansen won't tell you not to go for the surgery because we don't know enough, right? So if you want to have a very secure answer, please arrange for a consult with Dr. Jansen. And the beautiful thing is that now with teleconsult, you can even save the more expensive transport because of diesel prices going up in Philippines, right? You can do a teleconsult. Obviously, if you can watch Facebook, your internet access is good. So have a good teleconsult with Dr. Jansen, and I'm sure you will get an answer that your mom and yourself are comfortable with. All right.
I agree. I definitely agree. If I may suggest, go for a consult with Doc Jansen and meet with him this coming May 30 in our
That's
upcoming
right.
SMX
In person.
event. That's right. Thank you. Like we said, for those of you who wish to have a consult with Doc Jansen, simply type in how to consult. Our caring HCS, Miss Beth and Miss Irish, will message you individually. All right, for our next question, it's quite interesting, thrown to us privately by Miss Gina. Okay, the question is, I accidentally put unopened PPARs powder in the freezer. Is it
Okay.
still safe to consume?
Okay, first of all, you must check the expiration date, and then number one, how long have you put it in the freezer? All right. So I can't answer your question just like that. You're missing very important information. How long did you put it in the freezer? All right. We never actually encourage people to put it in the freezer because there are live enzymes in your Simply Nature People extract powder. Okay, so if you've only put it in there for 1 week, 2 weeks, yeah, it's safe to eat. Is it effective? I'm not sure. Again, because I don't know how cold your freezer is, what's the condition of your freezer. So we only put the pipa powder in the refrigerator, not in the freezer compartment, in the lower normal compartment where you put your normal vegetables and things like that, right? Okay, so I can't answer your question directly. If you've opened it and it's not more than 3 weeks and you've been putting it in the freezer, it's safe to eat. All right. Now, will it give you the results that you want for your medical condition? I can't answer that unless I have more information. All right.
Thank you, Sir Sean. Dr. Jansen, would you like to add anything?
No, that's not my area. That would be manufacturers.
Correct.
I'm
That's mine.
also curious if
That's
it can be placed in the freezer or not. But yeah, We usually just place it in the cool, dark room.
Yeah.
Cool, not
Yeah.
freezing.
Yeah, and for your information, everyone, you notice that the pipa jar, right? We give you a plastic spoon. There's a reason for this, okay? Because metal spoons have an electrical charge. So when you have an electrical charge, when you scoop it, live enzymes, when you eat products that are still alive, the electrical charge can rupture the cell wall. All right. So this is why, and then compromise. It won't make the thing ineffective, but it will lower the effectivity by a little bit. So even a little bit, we don't want to do that. Okay, so that's why we have plastic spoon. And that if you lost your plastic spoon, then I will advise you to go and get the coffee stirrer from McDonald's. They also have a little spoon at the end, right? You can get that, or you can use a wooden spoon. Same advice. If you buy expensive Manuka honey, do not use a metal spoon.
Mhm.
That's why whenever you buy honey, expensive honey, they give you a wooden spoon for the same reason, right? Because metal spoons have electrical charge. Okay? Yeah.
We usually simply say, if you lost your scooper, you buy another one, you get a new free scooper.
That's a very expensive plastic spoon. Okay.
There you go. Thank you, Sir Sean. Okay, for
Yeah.
our next question, okay, coming from Mr. Romel, is Peeper's liquid overkill for a prostate cancer? Gleason 7, 3+4.
No, not really. Not really. I would surmise that it's just right. But just for everybody's knowledge, no, the type of product or the PPAR product. Okay, this is mine. This is how I use it. I use them. I don't look at the stage or the grade of the cancer for me to choose what PPAR product I will prescribe a patient.
Wow.
Regardless of whether it's tablets or liquid, there would be an effect. Okay.
Mm.
The factor in which influences my choice is
Mm.
the ability of the patient to take the product. Number two is the inflammatory marker or the degree of inflammation that's present in the patient. And what procedures affects the inflammation level, the inflammatory levels. So that's the factor. Those are the factors in which I choose which PPAR product I prescribe for the patient. So I'll give you an example. If a patient seemingly okay, quite strong, if you look at the patient is not sick, then the patient tells you, "Doc, I have stage 4 cancer." But if you look at the inflammatory markers, it's actually optimal. Okay, I would choose either the soft gel or the tablets for the patient because the patient is strong. Okay, um, if this same patient so happens that the patient will undergo chemotherapy or about to undergo chemotherapy, then I will shift to liquid or to the soft gel. Okay? The powder I seldomly prescribe. The reason being is for chemotherapy, they usually develop mucositis, which is mouth sores. So if you have mouth sores and you take the powder, it's gonna be very, very painful for you. Okay. So that's how I choose which product to recommend patients. Okay, not really the stage of the cancer or the grade of the cancer per se. But these do factor in, but they're not the top that influences my choice. Okay, this is me. I don't know with the other Simply Nature doctors, but this is me. Okay.
Uh, so
Uh-huh.
I will chime in also because there are many doctors who use it differently. So I'll give another insight. We have one of the top orthomolecular practitioners. He is a doctor, but he's a doctor in biochemistry. So he uses Simply Nature PPAR extracts as an agonist, as a catalyst, right? So he has his treatment protocol has three pillars, right? So number one, he believes very strongly in vitamin C. So vitamin C is one of his key pillars. That means unless the patient's specific illness does not do well with vitamin C, all his patients will be on high dosage of vitamin C. Okay, so that's number one. Then number two, he will tailor a combination of nutrients specifically for the illness. So for orthomolecular, their concept is to create a greenhouse, diba? So that means you create the best environment and let the body heal itself. So he will increase all the nutrients that the body needs. And the last pillar is Simply Nature PPAR agonist. He usually uses the liquid. Okay. So what it does is like it's the one that boosts the effect of the other two. So the PPAR is like the activator, the booster, right? So that's how one of our doctors use. For myself, my general guideline is this: if you want therapeutic, anything more than eczema, blood cholesterol, anything more than your normal chronic illnesses, right? So if you have a goiter, if you have a tumor, all this, right, cancer, then definitely you start with minimum the soft gel capsules. But really, if you want to see effect, I will go for the powder and the liquid. I also agree with Dr. Jansen. My choice of liquid or powder is not dependent on the staging. To me, is if you have cancer, then I'll tell you the best thing that you can ever take is the liquid lung. Okay. So in fact, I just had in Singapore, I have a really wealthy client. He has been diagnosed with mouth cancer, right? So he's very, very wealthy. So he just went for the liquid, and guess what? It's doing so well. I think in 2 months, he's already on his sixth or seventh box of liquid already, and he's not stopping. He's so excited. He actually felt energetic. He felt all these other health benefits he saw immediately. But what's really important is for his condition in the mouth cancer, it actually got better, right? But he's still going to proceed with the surgery. So again, like what Dr. Jansen says, right? If you're fighting cancer, get rid of the headquarters. So the surgery is possible, so he's going to go for the surgery. He was really hesitant at first because it might affect his speech, and part of his work does require, he manages a big team, right? So there were some considerations, but after talking to the surgeon, I think the situation also improved. So I think the surgery is also not as extensive as originally, right? So he's gonna go for the surgery, and he's taking liquid every day. So there you go. So similar to Dr. Jansen, however, for me, anything acute, any serious illness or things that are serious, like I'll give another example. So we go move away from cancer. We actually had a patient in Cebu many years ago, about 10 years ago. The patient is an 80-year-old man. There is no specific illness. He's dying from organ failure. From what type of organ failure? Old age. There is no, he's not sick. He's just old and his organs are failing, right? So there's nothing the doctors could identify as a problem. He doesn't have a specific illness. So what happened was that the son wanted to do something for his dad, so he actually fed him liquid, and the father got strong and got stronger and stronger. So he was actually on the deathbed, but actually recovered. Unfortunately, the dad was being fed through a feeding tube. The feeding tube got contaminated. They didn't clean it. It got infected, and he died from sepsis. All right. So again, anything in the serious arena, definitely the powder and the liquid.
Thank you, Sir Shyan. Thank you, Doctor. I love that you covered both the intentions in terms of how if the patient is capable to really take such PPAR form, and what type of severity this our PPAR products is perfect for. So I believe that a lot of our viewers can relate to how you answer the questions. And Sir Romel, thank you.
Yeah, because I agree with Dr. Jansen. If you have cancer, you have cancer, cancer results in death. It's not a flu, right? So you would just want to use the best, right? Yeah, it's just that serious, right?
That's right.
But of
Thank
course, the
you.
other consideration definitely, which our CSOs and HCS will help, right, is financial. Another
Yes.
reason that people choose is got to do with finances, and that's true also for chemotherapy. Sometimes patients don't choose chemotherapy because of the cost involved, especially if they cannot get any subsidies from the government. Yeah.
Financial is very valid concern.
Correct.
Thank you. Thank you, sir. Thank you, Dr. Jansen. Okay, for our next question, quite interesting, coming from Miss Marisa. How much do mammogram usually cost?
Oh.
You have to ask your local laboratory. I don't know.
Yeah.
All right.
I don't know.
May
But it's
may
gonna
I
cost a few thousands. Definitely not over 10. Definitely not
Oh,
over 10.
wow.
still high?
Okay. No, I'm surprised. Yeah, because 10,000 is $200 in Singapore. I'm quite sure it costs more than $200.
If I may, if I hope it's okay, I'd like to make it more relatable to our viewers.
Oh, wait. I
Um,
did a quick search just for
mm-mm.
this person, right? Oh, I'm so surprised. Government hospital, about 2,000 pesos. Private diagnostic center, 3,800. Okay, a 3D mammogram. Oh wow, this one can cost about 9 to 14,000. So I don't know how correct this is. Okay, this one they actually list like St. Luke's McCarthy Met between 5,000 to 9,000 pesos. All right. So okay.
Really depends.
Fact checked it is a Gemini answer. I don't know how correct it is. All right. Yeah.
Thank you. Thank you. All right.
So I
Maybe
was
let's.
right. I was right in my estimate. Not more than 10.
Yeah, you are right, Doc. Wow.
Oh,
Okay.
okay. Thank you. Thank you, Doc. Thank you, Sir Fan. Okay,
All right.
let's proceed to the next question. Okay, is PPARs perfect or good for all types of cancer? Question coming from Mr. Razorate.
Yeah. The reason is because you see,
Yeah.
what's the difference between
You can.
chemotherapy and PPARs? For chemotherapy, you have to use the right chemotherapy drug, okay? Because the drug works on the cancer. It works on the cancer, right? So it's tailored for the cancer. PPARs does not work on the cancer. It works on your own immune system. Your immune system is able to function for all types of cancer. So not only cancer, but other illnesses as well, which is why today in our programs, you can see we use PPAR extract liquid for all the way from thyroid nodes to cancer. So it's not. So how can this thing, if it's for cancer, I mean, if it targets a cancer cell, it shouldn't work on a thyroid node, right? So that's why it doesn't work on the cancer cells. It works on your own immune system, and it also helps your body. Lots of mechanisms at work. So the metabolic pathways, the inflammation, and the immune response, right? So these are the key factors in fighting and managing cancer. So yes, this is the reason why the PPARs will work in general for all types of cancer. So you have cancers that are tumor cancers, you have cancers that are not tumors, like for example, leukemia, right? They are not tumors, right? So there are many different mechanisms at work. All of them don't actually work on the cancer itself. It works on the body, and which is why it's very different from chemotherapy or even immunotherapy. Every immunotherapy is targeted for specific types of cancer. So your immunotherapy drug for breast cancer is different from your immunotherapy drug for liver cancer, and so on and so forth. Yeah.
Thank you, Sir Sean. Dr. Jansen, please proceed to the next question.
Yeah, that's the answer. It can be used for all kinds of cancers.
Yeah.
With there one thing that I'm not quite sure 100%, no, it would be
Hmm.
CNS cancers or central nervous
Oh,
system tumors, no.
okay.
Because we still don't know if the PPAR agonists themselves from the product can cross the blood-brain barrier. I don't know if it's published now, the data, but the ingredients inside the product, since the product so it's an extract of
Hmm.
microalgae. So
Hmm.
the extract of the microalgae are fatty acids. So some of the fatty acids in there would be EPA and DHA. EPA
Hmm.
and DHA are known to cross the blood-brain barrier. So I wouldn't say that CNS tumors will be totally excluded from the cancers in which it will be effective, but indirectly, yes,
Mm.
it can impact central nervous system tumors. Yeah, because of the EPA and DHA content.
We do actually, even Dr. Jansen has a particular pediatric patient that had a brain tumor, if I'm not wrong. And then we've had plenty of cases. The most interesting one was the fact that one of our doctors used it as a tranquilizer to manage neuroinflammation as well. So yeah, this is an interesting area of research. In fact, I'm actually constantly asking, because when we talk to our research team, they do ask what should we research next. I actually told them the next one I would really like them to do some research is mechanisms of action that affect CKD, simply because we have more and more CKD patients. Another good one will be the blood-brain barrier, because that's also my interest in terms of brain disorders. Yeah.
Yes, thank you. Thank you
Mm.
so much. Thank you for your answers, Sir Shyan and Dr. Jansen. For our next question, coming from Ms. Noreen Migrino, I am anemic. Can this medicine help to increase my HGP? Hemoglobin, doc, correct?
Yes, that's hemoglobin. The answer is it depends. What's the cause of the anemia? If the reason of the anemia is blood loss, then the answer is no. Okay? You need blood transfusion, okay, or to stop the bleeding. Now I will answer this in the context of cancer. Okay, since
Okay,
that's
wow, interesting.
the field in which I am, that's my field.
Mm.
Okay, so for cancer patients, why do they develop anemia? So one
Mm.
reason would be blood loss because tumors can bleed. Number two, if you are not bleeding, then inflammation can cause the anemia. Okay? So, cancer patients can go into an inflammatory state. Why? Because of the immune system. Okay? If your immune system is acting up, trying to contain the cancer, your immune system kills the cancer by inflammatory response. So if there is too much inflammation in your body, then that can produce anemia. Okay? That's why we have something what we call anemia of chronic disease. Because chronic diseases are in a state of inflammation or chronic inflammation. Okay? So now, um, this inflammatory state of the patient can also arise not only from uh, the immune action against the cancer. It can also arise from the hypermetabolic state that the cancer brings the patient in. So this hypermetabolic state means that the patient's body is trying to consume all the fuels or all the reserved fuels. So what are your reserve fuel? That would be your glucose, your fats, and your protein. Okay? So if you have inflammation and you have a state of hypermetabolism, that will lead to cachexia. Cachexia is a medical term that we use for cancer patients who are very, very thin, who are underweight, who are quite weak already. Okay? So how then do you um, stop stop the patient from losing further weight and from the cancer, from consuming all the reserve fuel, or the patient, consuming the patient. So you have to stop the cycle somewhere. So one thing that you have to act on would be the inflammation. Once you bring down the inflammation, the hypermetabolic or the hypermetabolism of the cancer cells would stop immediately. And that would also encourage protein production, especially muscle production. Okay, your muscle, it would prevent your muscle from losing mass. Okay, so how do you fight off inflammation in these kinds of patients? You give them omega-3. PPARs is very rich in omega-3.
Mm.
Actually, omega-3 itself is a PPAR agonist. But Simply Nature, it's a microalgae. The extract from the microalgae are fatty acids. It's basically omega-3. Okay? So you give mega doses of omega-3 to bring down the inflammatory state of the patient. Once you have brought down the inflammatory state, then the nutritional prescription or the nutrients that you're giving the patient would now have an impact. Okay, so this I will go deeper on May 30. Okay, but that's how you manage the anemia. Now, of course, would would taking omega-3 suffice? No, it's not enough. You have to give the other necessary nutrients like your B complexes, your iron, your selenium, your zinc, your vitamin D, your vitamin C, all these things. No, these has to be provided for the patient to help improve the hemoglobin. Now, there will also come a time that this will not, the patient will not respond to this, and this is the time that you inject erythropoietin or to stimulate the bone marrow to produce more red blood cells. Okay, that's how to go about this. Yeah, and this problem.
I
Okay.
learned so much today, Doc. Thank
So
you.
I want to,
Sir Sean.
so I want to ask you a question, right? I mean, one of your HCS, Beth, she herself has anemia. What kind of anemia does she actually suffer from? Because right now she seems to have improved a lot. I mean, her health in aspect. I didn't ask specifically about anemia though. Yeah.
I don't know. She hasn't disclosed this to me. I don't know. I don't
Okay,
really.
okay,
But
okay.
there are a lot of factors, no, for anemia. Anemia, remember, anemia is not a disease. It's a symptom.
Okay.
Okay? Anemia is a
So
symptom.
it's not okay, so it's okay, I like that. Anemia is not a disease, it's a symptom. So it's like saying that okay, that you're fair, right? I mean, okay, yeah, correct. Understand. So there
Yeah.
could be a lot of possibilities. It's
Yes,
like
like tough.
hypertension.
Yeah, like
Hypertension is also,
hypertension. Yes, it's
you
also
know,
it's a symptom. Yes.
yeah, correct. Like for me, my hypertension is not caused by high blood cholesterol. It's caused by lack of sleep.
Ah, yes.
Right? So yeah, so it's like not a disease, right? Yeah, okay, Ken.
Yeah, I
Mm.
like it even more when Doc Jansen was in the part where he was explaining that it can be improved through reducing inflammation, and PPARs is really in the
Yeah.
middle there.
That's why PPARs has a lot of applications, lang, that would and that maybe some viewers will find it strange that how come we can use it for like everything, it's because we understand the mechanism of action, what it does for your body. And really, everyone, inflammation is a big issue that can create a lot of problems for you. Yeah.
Thank you, sir. Thank you, Doc Jansen. Okay. Another person or another viewer just finished her CBC CBC test, and the question is, what to take to increase WBC count, and how much is that? I think the PPARs is talking about.
Okay, I'm going to answer this in the context of cancer again, okay? I'm not gonna entertain other disease entities that leads to low WBC count because one of them is HIV. Okay.
Okay.
So to increase in the context of cancers, no, when will you have a low WBC count? It's when you're undergoing chemo or radiation therapy. That's the time that you will have low white blood cell count. So if you are undergoing chemotherapy, radiation therapy, what is it in them that leads to the low white blood cell count? It's again the inflammation. So the inflammation is the one that's killing the white blood cells. Okay. Also, these two treatments are myelotoxic. So that's a mouthful, but what it basically means is that it's toxic to the bone marrow. Okay? When you give something that's toxic to the bone marrow, then the blood cell counts will go down. Okay? So how then do you stimulate or how then do you increase the white blood cells? You give something called filgrastim for the patient. Filgrastim is an injectable. And usually for my patients, the ones who I handle, they usually just receive 1 dose or 2 doses of filgrastim, and then they get more than enough white blood cells to go on the next cycle of chemotherapy. Now, for filgrastim, why do we want to increase the white blood cell count? Okay, it's because if your white blood cell count is low, you would be more susceptible to infection, particularly bacterial infection, in which you can die. Okay, you can go into sepsis and die. Okay, from a bacterial infection because your white blood cell count is low. Now, the white blood cell count, we have to further uh more details on that because there are different types of white blood cells. Okay, so it's like your white blood cells, that's your armed forces. Under the armed forces, you have your Coast Guard, you have your Air Force, you have your Marines, you have your Navy, you have your Navy SEALs. No, there are a lot of different groups in the Army Corps, which with specific functions. So for the white blood cells, the one that fights bacteria would be your neutrophils. Okay, so and that is what filgrastim stimulates for your white blood cell count to go up. Okay, that's the mechanism of action of filgrastim. Now the limitation of filgrastim is this: what it stimulates is neutrophils. It prevents you from dying from infection or it prevents you from dying from infection. But ultimately, what part of your immune system fights cancer? It's your lymphocytes, which filgrastim does not increase. It might influence increase in lymphocytes, but to a small degree only. So to help patients increase their lymphocyte count, what I give them is thymosin alpha 1. Okay, the organs in which filgrastim and thymosin alpha 1 acts on are also very different. Filgrastim acts on the bone marrow. Thymosin alpha 1 acts on the thymus. Okay, so two organs that produces immune cells, two different products that stimulates two different parts of your immune system. Okay. So that's how you increase your white blood cell count. Nutrients that you need for this would be, of course, the basic ones like your zinc, your vitamin C, your B complexes, your selenium, etc.
Your raw materials, right?
All of which can be from a healthy diet. Okay? Yeah. Protein, very important as well.
Okay.
But that's how you increase the white blood cell count or try to preserve the immune function of the patient.
Okay, I will go with the non-cancer things. Since Dr. Jansen sticks with the cancer perspective, let me go with the non-cancer one. So, okay, one of the earliest times before we focused on cancer, right? One of the times where our extract powder, okay, I'll speak specifically, extract powder, it was used for white blood cell count was in cases of extreme dengue fever. Right, so what happened is for dengue fever, the white blood cell count actually drops. So this one is actually one of my doctors who happened to be my ninang. So her son was actually struck with dengue fever, and his white blood cell count went to very, 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 very low. All right. So she called me up. She rushed to the hospital with extract powder, and actually within 12 hours, his white blood cell count recovered. Okay. So the mechanisms for this, the possible mechanisms for this is number one, scientific studies have shown that PPAR gamma is actually a key regulator for T cells, right? So when they actually promote T cells proliferation and survival, this helps with the WC count, WBC count, and like CD4 count also. So the next one, the most recent one, and this one, Sheila has actually met the patient. Patient is a HIV patient, right? So we did a video where we shot from the patient's behind, and of course we changed his voice because, yeah, you know the reasons why we did that, right? So he was actually his CD4 levels were very low. I think it was 40, something like that. Okay, so when an HIV patient CD4 is a type of white blood cell. It is not, so it's like one of the many different types of white blood cells, as Dr. Jansen mentioned. Neutrophils are also white blood cells. So his CD4 count actually went up, and that really shocked his doctors, because for many HIV patients, having a CD4 count go up, it's very difficult. And even when it happens, it usually takes about 1 month and above, right? But this patient's CD4 count actually rapidly rose to triple digits in less than 2 weeks. So this was something that was very good results. Now, again, in both cases, they were Hail Marys. That means they were already trying the drugs and nothing was working. For my Ninang's case, she herself actually is a doctor that uses Simply Nature PPARs, so she was very confident, right? So she chose it as a what's that called? As an alternative. So I would just want to share with you, that's our experience. Again, I will always say, if you have an acute case, emergency case, please go to the hospital, right? Because it's acute. Let your doctors treat, okay? I gave you these two examples is so that you know that, yes, it does have an impact on your WBC count, right? It does have an impact on your WBC count. So as Dr. Jansen has said, you didn't share with us why your WBC count is low, and how low is it, and how critical is it. So again, this is whatever we say is for your general knowledge, so that you know what is possible. But what is possible doesn't mean that it's suitable for your case, okay? So please still go for a proper consult so that you can better understand, all right? Yeah.
Mr. Shyan, thank you, Dr. Jansen. For those of you who wish to have a consult with Dr. Jansen, simply type in how to consult. If Beth and Miss Irish will message you right away individually. All right, coming from our viewer, Miss Lyra Poblete, question is, good evening, I have breast cancer stage 4 with METs, ER/PR, HER2, new all, 3 positive. What is your treatment protocol, and can PPARs be combined with chemotherapy? Not yet into surgery because tumor is big.
Yeah, okay. For this, I'll discuss how I treat this two ways. So if you are undergoing what we call as a, I'm not gonna call it neoadjuvant, but because you're stage 4, but basically systemic cancer treatment, no, from the medical oncologist, then what I give is a supportive treatment. So what I do as a support is to lower inflammation, very important. Lower inflammation, give the necessary nutrients that your body needs through nutrition prescription, through nutrition. The nutrition that I usually prescribe for patients is a Mediterranean dietary pattern. Okay? The Mediterranean dietary pattern is the diet that gives the patient the most increase in survival, and the diet that is by default would better fit a patient that's undergoing chemotherapy. Because if you're undergoing chemotherapy, then the chances of you going into cachexia is very, very high. The reason being is because of the inflammation. So you need to eat. And the problem there is, if you're undergoing chemotherapy, guess what? Your appetite is not gonna be there. So it's very, very difficult. So the nutrition density that you have to eat is it should be high. Okay, and a Mediterranean dietary pattern is something that can that caloric requirement, and also it's better adhere to, because it's not too restrictive. Okay, other diets which I will discuss on May 30. Okay, so you have the diet, you have the inflammation. So the inflammation, how do we lower this? So by giving supplements. So one supplement would be omega-3. Another supplement that I give is alpha lipoic acid. Okay, now these treatments, no, are anti-inflammatory. So by nature they have antioxidant activity. So if they have antioxidant activity, I do not mix them with chemotherapy, because chemotherapy is oxidative. So if you are receiving chemo and then and then your body is swimming with antioxidants, the efficacy of the chemotherapy can diminish. Okay, and we do not want that. So how I do it is I compute for the half-life of the chemotherapy, and then I base my calculation to determine when the patient can resume taking antioxidants again. So that would now be dependent on the chemotherapy that you're taking. Okay? So another aspect that usually is the reason why we tend to see tumors not responding to chemotherapy is resistance factors, no. So the resistance factors are, so cancer patients, no, or cancer cells usually express genes that can make it resist treatment. Okay, one such gene can produce it can produce a pump in which that pump, anything that passes through it, the cancer cell will spit out. So even if you're receiving chemotherapy, if the cancer cell has that, it will not die. Okay? So I usually give flavonoids, medications to inhibit that pump. There are a lot of ways on how to inhibit that pump, but inhibiting that pump is very, very important when you're undergoing chemo. This is for the chemo to remain effective. Okay? Um, so another aspect that I usually also look into would be the immune system. So since you're undergoing chemotherapy, the expectation is your immune system will go down. So I usually give basic immune boosters, immune stimulants for patients. So one of the core immune stimulants that I use would be Simply Nature PPARs. Okay, one way or another, patients would be on this protocol. All right. So the beauty about Simply Nature PPARs is that with one product, you target a lot of things.
Everything.
Okay. So you target the immune system, you target the inflammation, you help recover the bone marrow. The PPARs also have a way to curb or to slow the cancer cell division. Okay, it also inhibits something that we something what we call as matrix metalloproteinases. So the matrix metalloproteinases is an enzyme that cancer cells produce to dissolve the matrix around it so that it can escape. Okay, it inhibits that enzyme. PPARs acts on cancer at different levels, so that's why it's part of my core protocols. No, another one is the thymosin alpha 1. For almost all of my cancer patients, I put them on thymosin alpha 1 to stimulate the lymphocyte production. So because the lymphocytes, that's the part of your immune system that kills the cancer. Okay, so that's the immune that's part of the immune. Okay, so that's supportive part. Okay, I have a different protocol if you are not undergoing chemo. Now this protocol, I usually use high dose intravenous vitamin C already, because high dose intravenous vitamin C is proxidant. It acts on the cancer by way of Fenton reaction. I will not explain it here, okay? Just Google Fenton reaction. But basically, the vitamin C acts on the iron inside the cancer cell to produce hydrogen peroxide. The hydrogen peroxide is the one that's going to kill the cancer. It will not affect the healthy cells because healthy cells have catalase that eats the hydrogen peroxide. Okay? So that's what I use to replace in replacement of the chemo. Okay, now can high dose intravenous vitamin given together with chemotherapy? My take on it is vitamin C, yes, but not high dose. I will reduce the dose of vitamin C to help the patient recover from the chemo, or else you would have two pro-oxidant treatments in series of each other, which will tire the patient a lot. It would be too toxic to for the patient. Okay, so I usually don't give high doses of vitamin C if the patient is already receiving chemo. I still use vitamin C, but at lower doses. Okay, so that's one. I also use repurposed drugs like ivermectin, mebendazole. These antiparasitic drugs, they have been shown to have anti-cancer activities. So I use them as well. Now, ivermectin mebendazole, the way it kills or the way it stops cancer is by way of reducing the replication rate of the cancer. Okay? So ivermectin, by the way, also can inhibit the efflux pump that I was explaining a while ago. So there are a lot of overlaps on how we can use these different supplements to help cancer patients. No, but those are the general paths, no, or general strategies that I use. There's a third one which I'm still not using, but I will introduce probably second quarter of the year or probably third quarter of the year, but definitely this year I will start introducing, which are cell therapies for cancer. So this is also immunotherapy, part of immunotherapy. Okay, so but just to give you guys an idea, the oncologists, the medical oncologists, no, the way they use immunotherapy for patients is to give a medication that will tag the cancer cells so that the cancer can be detected by the immune system for the immune system to kill the cancer cell. That's immunotherapy for the medical oncologist. The immunotherapy that I use are cancer vaccines. I use immune cells. So immune cells that were primed that were taught to kill the tumors or the cancer cells. I will not say the brand name yet, but that's the mechanism of action. Okay, so that's one. Another one is dendritic cell therapy. It's by giving you trained dendritic cells, so trained scouts to detect the cancer so that your immune system can go and kill the cancer. Okay. Another one would be SOT. So SOT is like an antidote for a poison in which the poison is the cancer cell. Okay. So these are new therapies that I will introduce later this year. So those are some.
Did you say SOT or SOD?
Yes. SOT. SOT.
SOT. Huh? T.
Yes.
Oh, all right. Okay, that's
Supportive
interesting.
oligonucleotide therapy.
All right.
Yeah.
So there are things that what Jansen said about his new therapies that he'll be using. A few things I picked out that got me excited is he said dendritic cells. So I just want to share with you Simply Nature liquid extracts has been proven by a study to actually increase dendritic cell activity. What Dr. Jansen said one is not just increased dendritic cell, but trained dendritic cells. So that one is a bit different. So one is like make your dendritic cells more adaptive. The other one is you already trained the dendritic cell. So again, here's the beautiful thing. Since you're using Simply Nature PPARs to manage other aspects, you get the best of both worlds. You get higher dendritic cell activities and you get trained dendritic cells. I just think that is so synergistical. So for this particular patient that asked this question, I think the answer is clear. Have a consult with Dr. Jansen, please. Have a consult with Dr. Jansen, all right? So at least now you have an idea what Dr. Jansen approach is going to be across the board, right? So if you have any particular inclination, one thing that I've seen Dr. Jansen change over the years is that I find that as he has treated more and more patients, and especially maybe patients who are elderly, Dr. Jansen and I both have also learned to have this thing called respect what the patient wants. So we know many of you come on our program looking for natural therapy, and we are happy to share with you natural therapies. But at the same time, we also want to also list out the options of conventional medicine because we just want to make sure that you know, all right? At the end of the day, when you consult with Dr. Jansen, you just let him know your preferences. And of course, possibly also let him know why. Because if the reason why you want to do all natural is because you're afraid, then maybe that's not a very good reason. So, so Dr. Jansen can probably share with you, you don't need to be afraid of this. It's actually, that is a myth, okay? Yeah, but then, like for example, chest surgery, you don't have to cut a big hole in your chest. It's only 5 centimeters, very small like this. So no need to be afraid, right? But of course, if you can have very valid reason why you don't want conventional medicine. For example, if you're an elderly and you don't want that, you want quality of life. That means not you rather have a higher chance of you just don't want to risk the complications that come with conventional treatment, and you're okay with maybe the cancer not really getting totally healed, but you're okay with an improved quality of life. So again, there are many reasons why. Just in your consult, let Dr. Jansen know. All right. Yeah.
Thank you, sir. Thank you, Sir Shyan. Thank you, Doc Jansen. Well, for the
Last question.
person, yeah, actually,
It's 8:30 already. I'm also tired.
okay. It is actually our last question for today. All right, coming from Mr. Eddie Boy. Actually, two of them, Eddie Boy and Mr. J. They both have the same concern, which is prostate enlargement. What is the best recommendation for this prostate enlargement? Mm.
You have to know why the prostate is enlarged in the first place. But this is usually either hormone or cancer.
Mm.
Okay. You have to find out first, no, to know what treatment can be given. Okay. So for hormones, you have to take a look at the metabolic aspect, and usually to shrink the prostate, it's very simple. Just use dutasteride. Dutasteride can shrink the prostate quite fast actually. It can do it in a span of within months. It can be done within a year. Okay. So very simple. But if it is prostate cancer, of course, that's a different story, and more aspects of your health has to be looked into, and those um things in your health would have to be addressed, okay, aside from the prostate cancer itself. So for the prostate cancer, okay, I'm not gonna repeat myself already. I've told you my strategies, so I use those strategies. If you can remove the tumor, no, the tumor, the prostate cancer, then that would be better. But there are a lot of side effects, no, arising from that, which can make a man not go for the surgery totally. Being impotence, no, or erectile dysfunction, which are very 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 very
Serious.
negatively very very serious, which
Uh,
negatively impacts quality of life. So surgery, sometimes we don't go for surgery and we opt for other treatment options, hoping that the tumor shrinks. But again, no, if you are not going to go for the conventional oncology treatment approach, no, integrative oncology can promise you one thing, which is to make sure that the cancer does not spread further.
wow.
Shrinkage is a bonus. Okay? So what I tell my patients always is that um when we begin treatment, we make goals. The first goal is to stop the cancer from getting bigger or getting or metastasizing. That's the first step. Okay? And once we have achieved that, then we continue on and press further so that we try to attempt tumor size reduction. Now, if we are able to achieve tumor size reduction, that's a bonus. Okay? That is a bonus. So this is something real that I just want to share with everybody so that we are not
Mm.
over promising, and you're also careful of the products that are being sold to you out there. Okay? Yeah.
Thank you, Dr. Shan. Sir Shan.
For prostate enlargement and enhanced possibility of prostate cancer, I have really one very good news for everyone. In the sense that I have a patient, a doctor, right? Patient, but he himself is a doctor, right? So he's actually his testimonial can be found on our YouTube page. All right. So if I'm not wrong, to this year he should be 90 already or 90 plus. Okay. So back then he was stage 3, I think, prostate cancer. So he took only our soft gel capsules. It's been 10 years. He's still around, healthy. And I'm not sure if his prostate cancer is gone. I will ask him the next time I see him, but I'm now in Singapore, right? Okay, but like what Dr. Jansen says, if you can stop the cancer from spreading and from growing, for prostate cancer, I guess you can really have a long and full life. So this particular doctor that I know is still on the soft gel capsules, still. He is very active. He drives a very cool Mini Cooper. He's full of life. He looks strong. He is like a Sean Connery. If you're a lady, you look at him, he is a sexy old man, right? So he's a man's man. It's been 10 years that I know him. When I knew him, he actually had third stage prostate cancer. He's still around. So, and he's doing well, strong. Okay. So, and just to let you know, his kids, I think 2 or 3 kids, all of them are doctors, right? So yet their dad is still around. So it works. The strategy for prostate cancer is there. So if you have that, please make a consult, arrange for a consult with Dr. Jansen. He'll be able to really, really help you.
Thank you. Thank you, Dr. Jansen, and thank you, Sir Shyan, for answering and covering both, not only the prostate enlargement, but also the prostate cancer. Technically, as per observations, it tends to be becoming one of a common concern in our queries here in Simply Nature. So thank you. By the way, just to help out our viewers, the testimonial you mentioned earlier, Sir Shyan, about the HIV, I've pasted the YouTube link so that they can watch, and also the prostate cancer. By watching these videos, you will be led to our YouTube channel where you can watch not only the testimonials but also our past webinars as well. So please subscribe to our YouTube channel so you can always be updated with this testimonial too. All right. Well, it looks like we've covered all our questions tonight, and I'm afraid that that's all the time that we've had. So don't worry, for those questions that you are quite shy to ask us tonight, you can still ask them privately so that you can answer right away. And of course, those of you who wish to have a consult with Dr. Jansen, simply still type in or just message us how to consult. We'll definitely forward you to Miss Beth and Miss Irish for you to be scheduled. All right, so we're almost at the end of the webinar. As we wrap up this evening, we would love to hear your final thoughts. Remember, not only to all our viewers, but mostly to all our moms this coming weekend. Sir Shyan and Dr. Jansen. Dr. Jansen, would you like to go first?
Yeah. So happy Mother's Day to all of the mothers out there, to Sheila, to my mom, to my wife. Then I'll see you guys on May 30, face to face. So we're going to share the nutrition prescription that I usually share with patients. I have updated this multiple times for half a decade. So a lot of revisions went in. It is now also aesthetically pleasing to the eyes because of AI. AI shortened finally. And actually, sir, to be honest, no, Sir Shyan was trying to encourage me to write a book.
Yes, I think now we can.
Yeah, I think now we can. This small or very short nutrition prescription is a start.
Yeah.
It's actually a small ebook already. Technically, it's an ebook because it's 10 pages long at A4 size. If you condense it to like
It's actually
small
an ebook already.
that's gonna extend. It's already an ebook, no? So we're going to share those materials on May 30. So please come so you can get a copy yourself. No? So that would be all. I'll give the floor back to Sir Shyan. Good night, everyone. Thank you.
When I see Dr. Jansen on May 30th, I'm gonna encourage him to write a book, right? His journey to integrative oncology. Right? So I think it'll be interesting to see it'll be so good for our patients to read how a doctor Dr. Jansen was actually prepared to specialize as an oncologist. And then he found other options. And now he's one of the leading doctors in the area of integrative oncology, right? And how to both attack cancer and also to support cancer when you're using it with conventional medicine. So I think the journey he went through will probably give you so many insights and clues to how you can approach your fight against cancer. So I'll try and persuade him to write that book now with AI. It's all the more, even more possible. All right. So again, thank you everyone for watching. We're very excited to see you guys face to face on 30th of May. It's going to be a wonderful experience. Every time we have an SMX, it's a wonderful experience. People don't want to go home, and then we have to tell people you have to go because the venue is only paid until until 1 p.m., right? But people stay behind, they chat with Dr. Jansen, they chat with our other guest doctors which includes in the past Dr. Jimmy, Dr. Joy, and then we even have doctors that actually come. So doctors that work with us, they just come as a participant, not actually as a speaker. And sometimes you get to interact with all these people. And more importantly, also, you get to interact with fellow cancer patients. And you can hear from their journey and be encouraged as well. All right. So with that, I hand the time back over to Sheila.
Thank you. Thank you, Sir Shyan. Okay, well, thank you so much for all your questions, and thank you for considering our program a program of value while you journey with your own health battles. And on behalf of our patients and viewers, thank you so much, Sir Sean and Dr. Jansen Kalalan, for putting so much effort in and care towards all our questions tonight. Now, of course, exclusive. Okay, I just have. Please stay tuned up until the end of the program because we have a lot of exciting announcements to share and exclusive for website orders only. Yes, you can still buy your PPARs liquid extract or PPARs powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promo. Once again, this promo is only available via website www.simplynature.asia. So once again, before we say goodbye, we want to share this powerful double action deal for your health because if you buy PPARs powder jar or the PPARs liquid extract box via website and receive a free AD Prom serum, combining internal cellular support with premium external skin nourishment, plus you'll enjoy free shipping on your order. Wow, back-to-back promo, right? So, but if you are on a tight budget, that's okay because we've got you covered with a free venue mask included when you purchase any PPAR soft gel tri-pack or tri-blister. These exclusive promos are available now via direct or via website. Again, www.simplynature.asia. Grab yours today to complete your total wellness regimen. Okay, so please stop struggling with stubborn eczema, psoriasis, or acne and level up your skin game with AD Probiotic Serum. This advanced formula is specifically designed to restore your skin barrier for long-term results. So the best part is that you can buy one and get one. And this promo is still ongoing, but only for a limited time only. So please grab your duo now on Shopee, Lazmall, our website, or via direct here in our BGC office. Okay, so big news, health warriors, your favorite flagship products or other Simply Nature PPARs products have now officially landed on TikTok Shop. We're making it easier for all of you to order our products. So head over to our official Simply Nature TikTok account now to grab your wellness essentials and catch exclusive live demos and take advantage of the seamless ordering via TikTok. Okay, so great news, everyone. We're expanding our hours. Actually, we started it last 2 months ago because you are experiencing a Saturday dose of wellness at our BGC office. So visit us this Saturday from 10 a.m. to 4 p.m. for an exclusive consultation with our resident pharmacist, Ms Jhen Macanjola. Get expert pharmacist choice, advice on boosting immunity, and cellular nutrition to elevate your health journey. So yeah, even better, because if you buy PPARs liquid extract or PPARs powder extract, you can actually get free umbrella if you purchase them on site here in our BGC office. So please visit us. We would love to see you in person. Okay. All right, and of course, for our moms, all our moms out there, happy Mother's Day this coming weekend. Celebrate the woman who holds everything together with a gift that truly pours back into her. So this Mother's Day, Simply Nature wants to help our moms in being resilient, vibrant, and healthy because we simply want them to be strong. And whether she's looking to revitalize her energy or find better balance, our PPARs extract soft gel capsules, the tri-pack, or the Stay Slim package, which is a comprehensive 30-day immunity booster that will help the PMS and relieve constipation, is inclusive in the promo wherein if you buy the tri-pack or the Stay Slim package, you can actually get 5 sachets for free. So just use the promo code SimplyMom at the checkout in our website, www.simplynature.ph. Okay, and of course, lastly, if cancer has touched your life, remember that remission is only their beginning. The real work lies in building a body that sustains long-term recovery. So join us this coming May 30, 2026 at SMXSM Aura DGC for our powerhouse seminar, Beyond Remission, where elite experts unpack the science of metabolic stability and inflammation control. The seats are limited and are just limited now. So please watch the video below to see why this event is a non-negotiable step in your healing journey. Please watch this.
Hi everyone, this is Shyan from Simply Nature and I bring you good news. Backed by popular demand, doing our regular SMX event. And the topic for upcoming May 30th event is Beyond Remission, Building a Body that Sustains Recovery. So if you are a cancer patient and you have questions about your diagnosis, what treatments are available and which treatments to take, if you don't know how to combine conventional treatments with natural treatments, then this is the place to be. Because I will be joined by one of the top integrative oncologists in the nation, Dr. Jansen Kalalan. Right, he will be sharing about innovative approaches to supporting cancer. So Dr. Jansen actually specializes in supporting cancer patients undergoing conventional treatment, but he's also an expert in integrative treatment for cancer. And again, like I said, it's a great event for you to ask questions because there will be a live Q&A or Ask Me Anything segment where Dr. Jansen and I will be sitting on stage together and perhaps we will be trying to invite other specialists as well, and you can ask your questions and all of us will be able to be there giving you live answers. This is an opportunity that you cannot miss. So seats are limited, secure them, and feel free to bring a loved one or caregiver with you. All right, so mark it down on your calendar, May 30th. It is a Saturday, 8 a.m. to 11 a.m. at SMX Aura in BGC. See you there.
See you on May 30th. So we hope to see you also next week for another episode of Simply Healed webinar coming. It's May 14, and that is once again same day, same time, Thursday night at 7:30 p.m. as well. Once again, thank you for spending your time with us tonight. This is Simply Healed webinar powered by SMG and SNI. And remember, your curiosity about your health conditions and your victories over cancer and metabolic illnesses are what keeps us going. Because here in Simply Nature, we're always with you from start to healing. Thanks, everybody. Good night, and God bless you all.